Healthcare hazard control. This chapter presents a proactive hazard control approach based on leadership involvement and the practice of effective management. The author frequently uses the term hazard control instead of safety when placing emphasis on preventing accidents, illnesses, and injuries. Senior healthcare leaders must learn to promote hazard control and safety as an organizational value. Hazard control effectiveness impacts both the overt and covert cultures of any healthcare organization. The safety culture of healthcare organizations must be recognizable by those served. Healthcare organizations seeking to maintain revenues, minimize losses, serve their communities, and meet regulatory or accreditation requirements need effective safety functions. Healthcare is one of the fastest-growing sectors of the U.S. economy, employing over 12 million workers, with women representing about 80% of the healthcare workforce. Rates of occupational injury to healthcare workers have risen over the past decade. Safety issues facing healthcare organizations include needle sticks, back injuries, slips and falls, laser hazards, chemical exposures, biological hazards, workplace violence, and community safety issues. An increased emphasis on topics such as emergency management, indoor air quality, and patient safety indicates that safety will remain a key function in healthcare organizations. Effective healthcare hazard control management continues to be overlooked despite the number of workers employed in healthcare-related occupations. Advances in medical technology and clinical treatment techniques expose workers and patients to a variety of potential hazards. The Occupational Safety and Health Administration, OSHA, continues to highlight the importance of safety and health for all healthcare organizations, including hospitals, nursing homes, surgery centers, and physician practices. Hazard control committees. Safety committees can make positive contributions to the success of the hazard control function. Committees can help review results of inspections, audits, and other evaluations. Top management that fails to properly assign committee responsibilities and delegate authority will undermine their effectiveness. Some top management personnel do acknowledge committee existence, but ignore their contributions and suggestions. An effective committee must work hard to interact with all organizational members to improve their hazard control awareness. Top management ultimately must take responsibility for committee successes and failures. Top management must also provide supporting systems, authority, and necessary resources to help ensure committee success. Committee authority and responsibilities can vary depending on the organization. Some organizations refrain from using the term committee and opt to use another term such as advisory panel. Regardless of the term used, committees, teams, and panels can help improve organizational hazard control efficiency and effectiveness if proactively involved. Hazard control management. Using the phrase of hazard control management does not diminish the importance of safety and other disciplines such as risk management, occupational health, or industrial hygiene. Hazard control management must focus on developing processes or systems that can help prevent harm and loss. An uncorrected hazard or hazardous situation could contribute to an event resulting in property damage, job interruption, personal harm, or adverse health effects. The process of controlling hazards may require development of written policies, plans, or procedures. Never consider hazard control as a program, but as a function of the organization. The hazard control function must connect with organizational structures and operational philosophies. Safety engineering addresses fundamental principles and rules used to identify, evaluate, and control hazards within man and machine interface systems. Consider safety engineering as the physical and mathematical components of loss control efforts. We must view hazard control management as an organizational function that addresses the leadership, behavioral, and administrative aspects of preventing loss. Hazard control management must provide the structure and insight for applying safety engineering and human factors principles to accident prevention. Safety engineers analyze the early design of a system to discover potential faults and flaws. Safe design needs derive from the selected parameters and associated acceptance criteria. The life cycle of systems includes design, research, development, evaluation, production, inventory, operational support, and disposal. Probabilistic fault tolerance adds redundancy to equipment and systems. Senior leaders must ensure that job descriptions address hazard control responsibilities inherent with each position or task.